Bismillahirrahmanirrahim. My name is Dr. Fakhariyat. You are watching our YouTube channel Medicos Fever. As we have started the surgery series of the upper GIT system, we have completed discussion about the esophagus. Now our topic of discussion is the stomach and the duodenum. Now in this lecture we will discuss arterial supply and that is the nervous supply of the stomach. सबसे पहले जो मोस्ट इंपॉर्टेंट है वो है यहाँ पे जो दैट इज द stomach is the most dilated portion of the gastrointestinal system. In this case, it is between esophagus and that of the intestine. Firstly, we will discuss about the arterial supply. It's mainly supplied by the celiac plexus. Celiac plexus is mainly, this is the lesser curvature of the stomach. This is the greater curvature of the stomach, which is attached to the omentum. Greater curvature of the stomach is attached to the greater omentum and lesser curvature is attached to the lesser omentum, and celiac plexus in the lesser omentum. This is the part of the celiac plexus. Firstly, this is our right side, this is our left side. Now left gastric artery, we will discuss the part of the stomach, then it will be easily appreciated. This is the cardia, this part is that of the fundus, this is the body of the stomach, then that is the antrum of the stomach. Now left gastric artery, LGA, left gastric artery supply that part of the esophagus which is the directly supplied by the celiac plexus. Now it will give the splenic artery, it will give the splenic artery. Second is that of splenic artery, and splenic artery supply the two branches. Number one is that of the provides the fundus, this is the short gastric artery. These are the short gastric artery which will supply the fundus of the stomach. Now this is, I have discussed, this is the omenta and this is the left side and left gastro-omental artery, or other name is the left gastro-epiploic artery. This is the left gastro-omental artery or epiploic artery. It may be named as epiploic or sometimes it's called as the omental artery. Other artery which is origin from the celiac plexus is that of the common hepatic artery. It is the CHA, common hepatic artery. Common hepatic artery has mainly three branches. Number one is the right gastric artery. This is the right side. As you know, right side, right gastric artery which supply the lesser curvature of the stomach, and anastomosis the left gastric artery. Both are anastomosis. Right gastric artery, which is a branch of common hepatic artery, anastomosis with the left gastric artery in the lesser curvature of the stomach. Now common hepatic artery gives rise to the hepatic artery proper, and this is mainly left hepatic artery, this is the right hepatic artery. This is the left hepatic artery, this is the right hepatic artery. This is the gallbladder, and gallbladder is supplied by the cystic artery which is a branch of the right hepatic artery. As the origin wise you have to be discussed, origin wise. Now we are probably coming toward the, this is the part of our duodenum and this is a gastric. Now common hepatic artery give rise to other branch, this is called as the, this is called as the hepatoduodenal artery. The hepatoduodenal artery, this is the, this is called as the gastroduodenal artery. Sorry, this is the gastroduodenal artery because this name is the gastric and the duodenum. gastroduodenal artery. And more probably, gastroduodenal artery gives the right gastric omental artery or right gastric epiploic artery, and in anastomosis with that of the left gastroepiploic artery. This is the right gastric omental or epiploic artery. राइट गैस्ट्रिक ओमेंटल और एपिपोलाइक, इसका ओमेंटल नाम भी हो सकता है, और जो दैट्स व्हाई दिस इज द ओमेंटल और एपिपोलाइक आर्टरी that we discussed about the arterial supply of the stomach. Now we are discussing about the nervous supply of the stomach. In this case, we have to be discussed the nervous supply of the stomach. Now we are making that of the, this is the esophagus, and this part is known as the stomach area, and hence it's mainly vagus nerve supply that of the stomach. Vagus nerve is mainly crossed from the esophageal hiatus. The opening in the diaphragm is called as the esophageal hiatus, and it may gives the mnemonic is that of L A R P, which is the mnemonic for easy to understand. Now it has interior part. Gastric has the interior part or the posterior part. Interior part is called as the left part. Left vagus artery, left vagus nerve. There are two types of vagus nerve. Number one is the right, and that is the left. Left vagus, that is the left vagus, supply the interior part. Left vagus, this is the right and the left. Left vagus supply the interior part, and it gives branch. This is called as the nerves of the lateral jet. This is the main probably. I will show by that. This is called as the nerves of the lateral jet. Nerves of the lateral jet. This is nerves of lateral jet. Now, nerves of lateral jet. This is end stages. This is called as the crew. Feed crew. That is feed crew, and supply that of the sphincter of the pyloric sphincter of the stomach. This is called as the left interior. Left vagus, which is supplying the interior part of the stomach. Okay, and other is a right posterior, which mainly supply that area, and that also supply the celiac plexus. The purpose of that, we give the, in case of the peptic ulcer disease or any other cancer, we have to be vagotomy, cut down of the vagus nerve. That's why we have to understand what are the most probably the mnemonic is the most important. That's why we have to discuss about the anatomy of the esophagus, then arterial supply, then we have discussed about that nervous supply. And thank you so much. Allah Hafiz. Please like and subscribe our channel Medicos Fever, and remember us in your prayers. Allah Hafiz.